We're here at HIMSS 2018 talking about EMPI with Shaz Ahmad, VP of Cloud Operations and Delivery at NextGate. Welcome, Shaz.
Thank you. Glad to be here.
Yeah, it's great to have you. So, you guys have been doing Cloud EMPI now, and it's one of your big announcements over the past little while. And so, what are the advantages and disadvantages of Cloud EMPI?
So EMPI in itself needs no recognition when it comes to NextGate EMPI, especially. I mean, we've been out there for some 20 years and organically grown. Everybody understands what we do, why we do it, and there's a big need out there. And a lot of companies use it to help unify their patient records and deduplication of the records, etc., to provide better patient care. When it comes to the cloud offering, what it does, I can only see advantages of using Cloud EMPI is to basically provide customers peace of mind by giving them hands-off approach to the same product that they have been using for so many years, and us taking care of all the management aspects of availability and the performance and the scale that they require. And customers no longer need to be worried about being a subject matter expert on our application stack, because we're there to do it for them. By giving it to us, by giving it into a cloud vendor's hands, and who's better than NextGate, of course, they can effectively do what they do best, whatever their business is, whether it's population health management or precision medicine or hospital business, whatever their core business is, they can now allow themselves to be focused on that and be brilliant at that, whilst the brilliant SMEs, the subject matter experts in NextGate, take care of the EMPI itself.
Mm-hmm. No, I think that's great, and it makes sense, right? Because a lot of organizations have challenges retaining people that know how to do it, or but if they just do it through the cloud with you, they don't have to have that expertise in-house. But are there times where it makes sense to go with an in-house EMPI solution versus a cloud?
My default answer to that is no. Why should anybody should do it when there is a service available? But I can see some use cases. There are some large organizations out there that have millions and millions of patients, and they have large IT departments, and people have spent enough time in, for example, we have one or two clients who've developed the application with us, and they understand the core of the product as we do for the last 15, 20 years. Other than that, there isn't much of a use case to, if there is a service to be consumed, why put your infrastructure up? Why have your teams go and learn another product that they have to go and manage? Why not just give it to somebody? And I was one of those clients myself. I was NextGate's enterprise clients for 5 years, and we learned in my previous job that this is one stack we didn't have to focus on, and it's best if somebody else does it. And people, the manufacturer of the product, if they do it, that's the best thing ever.
Well, and the infrastructure is almost a commodity. The key is what's happening in the cloud. So, but I think one fear that many organizations have when they look at it in a cloud offering is that the cost could balloon, right, as they do more and more EMPI in the cloud. And so, what are your comments about that? Is that a fear that's reasonable, or?
I think the fear is valid because it's the fear of unknown. However, the reality is quite the opposite. We in the cloud, we've done research, we've spoken to clients, we've done some test case studies with existing clients as well. The costs, actually, I would take the word cost away from the question, if you don't mind. I would say it improves the total cost of ownership for the customers. So it reduces the TCO for an organization by using our EMPI in our cloud, because now it's not just an infrastructure play. Anybody can use AWS, anybody can use Google Cloud. That's not rocket science. The science of the benefit, actual benefit of the Cloud EMPI would be that the customers can actually now no longer have to spend those hours in maintaining and the performance and the tuning and the analysis of the data. And if we do it, then they're just paying a subscription fee. And if you look at the term of a license, we've proven to our existing clients that they can actually save. I'm not going to say how many people they can actually save, but there is a significant saving.
Staffing cost savings that are part of that TCO that you talked about.
Absolutely, and that's the lower TCO is what we are absolutely telling all of our clients, that coming to us actually reduces their TCO and improves the bottom line.
Excellent. So I mean, I think another concern that many have with going to the cloud, which I think it's abating some because every healthcare organization has to go to the cloud for certain applications, but is security. What's your guys' approach to security? That they should feel comfortable knowing that NextGate's EMPI cloud is something they can, sleep well at night and not worry about.
So if I've lost all of my hair based on the security questions alone, that's an absolute valid fear. And it's not a matter of if, it's a matter of when anybody has to go through that issue of security.
But it's true on-premise versus cloud as well. So.
Well said. I was just going to say that. It's a threat that everybody has, regardless of which solution they choose, whether it's on-premise or in a cloud somewhere. It's a matter of how somebody will go and mitigate those risks and create enough barriers on their infrastructure and processes and network layers and this software in itself, closing all the vulnerabilities to ensure that there is enough barriers to entry for a hacker or anybody who would like to exploit the system. And like you said, the fear is always there anyway. But what we've done is we've chosen Amazon Web Services as our platform of choice, which has invested tremendous amount of money and effort into achieving some of the best standards out there, some of the best principles out there. So that takes care of most of the infrastructure. We've then taken one step further and we've put some intrusion detection, intrusion prevention, monitoring on the system, on our solution stack to make sure that if there is any unwanted access, we know about it before anybody else does. So we can then have our security incident management process kicks in, and then we go and triage and remediate before anything, before anything happens. In addition to that, what we also have employed is a least privilege model where if you don't need to have access to the production system, you don't have access to production. I'm running the SaaS in our practice, and I don't have access to production because I don't need to. And that is how we add another layer of that, let's say, mitigation, so to speak. So somebody who is wanting to exploit the system should have that barrier to their entry. And plus, security being the topmost concern for most of our existing and forthcoming clients, we have a roadmap to go and achieve high trust later in the year. We're exceeding the HIPAA compliance today as well in order to ensure that when we are the custodians of PHI, that's the most serious thing for us as well. We don't want to be in the front page of any news. I'm definitely not good enough looking anyway, so it's not going to be a good news story. So we make sure that we want to sleep at night peacefully, and in return that would give some peace of mind to our customers too.
That's great. Well, it's such an important thing. EMPI is a problem that everyone has, and so it's great that you're working on that and moving into the cloud, providing new options for them. So thanks for sharing your insights, and thanks to everyone for watching live. We're here at HIMSS 2018 with Shaz Ahmad from NextGate. So check it out, more great healthcare scene content at healthcarescene.com.